I was with my grandson in the car, parked at the bus stop, waiting for my granddaughter, and I had a burning sensation in my abdomen. I couldn't stand. I called over the other moms, and they called 911, and I went to the emergency room, and that's where it all started.
And I was called to the emergency room to see a patient with severe abdominal pain. And in the workup in the emergency room, she was found to have a mass in the lung and evidence of a perforated intestine. And this required emergent surgery. She wound up having a lymphoma, which involved both the lung and the small intestine.
Nothing prepares you for hearing the words that you have cancer.
When a patient hears the words, "you have cancer," the only word that's going through your mind is cancer. And that's usually followed by, how am I going to do this? Am I going to die? Up until this point, we have been able to meet the patient's needs by a major effort on the part of all the people involved in cancer care. Myself, the nursing staff, our dietary staff, our social work staff, all the other affiliated medical staffs have tried to implement the proper care and answer all the individual questions of a given patient.
I was very intrigued and happy at the naming of this person, the navigator, because there's a nautical theme to it, and Newport is celebrating the 375th anniversary, the city by the sea, and to move on the sea you need to navigate. And that's a sort of a parallel I like to use as to what the navigator can do for us, for the patients.
My experience at Newport Hospital was wonderful during my cancer treatment. It would have been that much better if I had had a patient navigator to help guide me through some difficult times.
It's relatively easy to figure out what to do for a patient medically, but have we really taken care of all of their needs? Have we delved into their mind, what is really bothering them? Oftentimes, it's something we would never think of. So any program such as a navigator, which would enhance a patient's ability and ease of mind to address these issues, ultimately would be of great benefit.
I was very surprised at how much goes into the care and treatment for a cancer patient. Being a survivor and going through it, it's difficult. You have 6 months or longer of your hair falling out, maybe a wig, maybe not a wig, maybe your skin care, things that when you see the physician, they're there for your direct medical needs. A patient navigator is there to help you through the process while you're going through your treatment for all the other things.
I think it is priceless to have the ability to have one person who is trained in this field, has special knowledge in this field, and has special knowledge about you individually and can tie that together without time constraints or any other constraints, really.
The various foundations and donors and trusts have been key in building this hospital to what it is.